Okay, I'll tell you the craziest thing that I had seen. Well, it's not the craziest thing, I should say. It's just kind of like I think back and I'm like, I can't believe that we did that. But we in Hawaii, we worked on a floor that specialized in heart failure. So we had a lot of patients come in with heart failure. Most of the time, they were in their 30s, meth induced heart failure. They only wanted to be in there to get some food and feel better. And then they wanted to go back to homelessness and drugs and live their merry life. So they only came in just to feel better.
When it was bad.
When it was so bad they couldn't breathe. So we would have limitations on how much they could drink and what they could eat. And we had one patient that came very often, and he got so mad that we were limiting, and he knew this. I mean, he'd been in the hospital so many times, so he knew what was coming and what the restrictions were. And he got so mad. And of course, in Hawaii, they shared a room with another patient. And so he was escalating. We had to eventually bring the cops in. And
did you have to restrain him?
No, we didn't restrain him, but we ended up paying for an Uber to take him somewhere else. He asked, he wanted to go somewhere else, and he didn't have the means to get there.
Somewhere else being another hospital?
Being another hospital. Yeah. So he was leaving AMA, which is against medical advice, and that was his prerogative. But the issue was, how was he going to get there? And so,
and did the hospital pay for the Uber?
No.
He paid for it himself?
No, the nurses did.
Oh, you got to be kidding me.
Yeah.
To get him out?
Yeah. I mean, he was causing trouble. I mean, and he was escalating. He was throwing stuff.
Oh,
He
I
was
get it.
trying to close the door. Well, we have another patient in there. So cops came, and cops were like, okay, you gotta, something has to happen. And so, yeah, we did.
So that's interesting. And this is a little unknown thing in medicine and I'm going to share a story with you along the same lines, is that these people get in this system and they don't leave.
Yep.
And they aren't paying their bills. Like that guy didn't have insurance.
No.
Like the hospital's eating this cost. And the hospitals have their hands tied because he's not well enough to go out. Like they can't say, okay, you can leave.
Right.
Because now it's not practice. But they want him out because, a nursing unit like yours is $4,000 or $5,000 a day that is costing the hospital to have that patient in there. But their hands are tied. And so they'll do these crazy things. Like, let's say the patient's mentally incapacitated. They'll go to the state and they'll get a ward assigned to them, a ward of the state. Well, that's like a 3-month process. And then the ward can make medical decisions for them because they can't make their own decisions. And so then once you get a ward, then the ward can help you get Medicaid, let's say, and get some funding. And then once you get Medicaid, then you have some more options and stuff like that. But all the time we'd have these we'd have these patients come into our hospital, and they'd be there for months on end, even though they're perfectly fine. Like medically, that we're doing nothing for them. They just don't have a place to go.
Right.
And because we know if we let them leave the hospital, we can't put them in that dangerous space. So legally, they had to babysit these people is the best way to describe it.
Take up a bed that could have gone to someone else
at $3,000 or $4,000 a day, and they're not getting reimbursed for it. So it becomes a hotel hospital.